credit. All right, y'all, we're going to go ahead and get ready. The Appropriations Committee is meeting, so unfortunately, I think we're going to have some members kind of coming in, coming out as their subcommittees meet and adjourn. So, but we are going to go ahead and get started. We're going to
tell the members to come on up.
If you are a member of the House or Senate, please feel free to come up and sit in one of these nice comfy chairs. You don't have to sit on the mean old wood benches. Out there. So y'all feel free to come up and really, Matt, I know he has a bad reputation, but if y'all just kind of come this way, and this Matt too, but you know, if y'all just kind of come this way and, I'm surrounded by Matts. But y'all come up and we're going to go ahead and get started. Polly McKinney is going to, just as a kind of a FYI as far as how this got started, I'm good at coming up with ideas, but not so much at follow through. So I came up with this great idea, to kind of give a brief introduction to members of the General Assembly, kind of where we fit in. Where the levers are as far as appropriations, policy, statute, rules and regs that some of our executive branch agencies and commissions have. So, and, I went to Polly with this great idea and she came up with this. So kudos to Polly and Voices for all of your hard work on this. So anyway, I'll turn it over to Polly.
Thank you so much, Madam Chair, and thank you, Mr. Chairman, as well, for allowing us to present to you guys on the Whole Child Primer. In a nutshell, for those of you that are not familiar with Voices for Georgia's Children, we are sort of a soup to nuts policy shop, and we do child policy that runs the gamut, as you can see in your book. The Georgia Statewide After School Network is housed in Voices. It's its own organization, but we all sort of team up and work together on after school and summer learning stuff as well. And today, because we have limited time and it's a little book, but it's a pretty easy read, we're going to ping through a number of experts in the child policy field, and each one will present a chapter of the book. And so I figure, I don't know how you want to handle any questions that might come up, if you want to do it per presenter or wait till the end, or...
Well, we'll just kind of play it by ear. We do need to kind of keep going.
Yeah.
The committee chair has rules at 9:30. So,
yep. So with that in mind.
But we'll kind of keep it rolling, and if it gets a little bit lengthy, then we can certainly kind of move that to a sidebar after the meeting.
Right,
so.
And of course, I put my presentation at the very end so I could cut and run if I had to. But anyway, with that, I'm going to go ahead and get started. I'm going to introduce Rebecca Rice. Where are you, Rebecca? Come on up. Rebecca's with Georgia Family Connection Partnership, and she's going to give a very quick overview of sort of the state of the child generally, and then we'll dive into the particular chapters. Do you want to present over there?
I can, or I can. Is the clicker here?
Yeah, clicker's here.
All right. Let's see if I can do this. Oh. Hey, Polly.
Yep.
Let's see. Where are my slides?
Oh, sorry.
That's okay.
Scooted all the way to the... We are, sorry. I should have said those recommendations. I'll get those at the end.
So I'm here to just give a really quick, really quick kind of high-level data overview of just a few indicators related to child and family well-being. For those of you who have heard me speak before, I intentionally did not caffeinate myself before this meeting, so hopefully I won't speed through everything. So anyway, again, I'm Rebecca Rice, and I'm the Georgia Kids Count Manager. So to dive right in, to one really fun statistic, children living in poverty. I don't know if y'all can see the slides, it might be a little bit difficult, but this is just a long-term trend map of the child poverty rate in Georgia since about 2001. So y'all can see we had a fairly slow increase in child poverty from about 2001 to 2008, and then you can see a major increase and pretty steep increase from 2008 to 2012, and I think we all know what happened between 2008 and 2012.
We do have copies of the slides. So just so
Oh, okay, perfect. Great, okay. And so now you can see we've declined for the past 4 or 5 years or so, and so we are now back down to about a 21% child poverty rate, so moving in the right direction, but with the cognizance that more than 1 in 5 children in Georgia still live in poverty. And again, these are just really high-level data points, and the folks who come after me are going to give a lot more context. Another data point that we track pretty closely is our percentage of low birth weight births, and there's a couple of reasons we track that. On one side, it can really speak to overall maternal health of a state or a community. So when we see the percentage of low birth weight births go up, we kind of wonder there might be something going on with maternal health in our state. And then from the infant side, it has a lot of significance for both infant mortality as well as developmental delays for those infants. And so again, you can see we're at a kind of an all-time high since this indicator has been tracked since 1994. So that's a bit concerning. Here's another one in kind of the health sector. It's percent of children without health insurance. We only have this particular statistic since about 2013. So as you can see, from 2013 to 2016, we saw a decline in the percentage of children who did not have health insurance, which is good. And then 2016 to 2017 represented the first year where we saw a little bit of an uptick in the percentage of kids without health insurance. This one speaks, now we're going into some education indicators. So this is centers and family child care homes that are rated and quality rated, and these are people who have completed or are fully rated, not people in the process of being rated. And so you can see when we started in 2014, about 5% of centers and family care homes were rated, and by 2018, that number had gotten to 32%. Also pulled third grade students achieving proficient or above on the Milestones English Language Arts Assessment, which does incorporate grade level reading. And you can see after a little bit of a dip from 2015 to 2016, we've seen increases in 2017 to 2018. We're now over 37% of children proficient or above on English Language Arts. So good news that it's moving in the right direction, but that still does mean that 63% of children in Georgia are not proficient. And then finally, I'm ending on a high note, percentage of students who graduate from high school on time. We know that on-time graduation opens up a lot of doors from post-collegiate or post-secondary education to military service. And so we can see that in 2011, our graduation rate was right around 68%. In 2017, we finally passed kind of the 80% threshold. And then in 2018, we got to 81.6% of on-time graduation rate. So moving in the right direction, but still about 19% of kids who don't graduate on time. So again, there's a lot of movement in the right direction, but with the realization that there's still a long way to go on some of these, and there's work to keep doing. So, and I think that is my time. So, if there are any questions.
I will follow up. I would just like to know kind of where we stack up with other states.
Sure.
So I'll follow up and I'll send that out to the other committee members.
Do you want me to tell you where we stack up?
Sure.
Okay, I can just in terms of general ranking where we are.
Just as far as like low birth weights.
We're typically we lag other states. In most of these, there are several indicators where we've actually gotten really close to the national average. Like we're getting better, we're getting closer on high school graduation, we're getting closer on some reading and math scores, but on some of the ones that I pulled, where we typically lag the national average, though we're getting closer.
Yeah. Now, where is as far as the milestones, the third grade milestones, we're at 37.4. Where is the national average?
I'm going to let Ariane take that one.
It's the national average.
Okay.
It's the same as the nation.
Oh, it is. Okay, so we're exactly the middle of the road.
And we're pretty much average on NAEP too, right? Anyway, doesn't matter.
So, and as far as the students who graduate from high school, we're at 81.6. Where's the national average?
I don't know the exact statistic off the top of my head, but we're getting closer, but we do lag the national average.
All right.
It's 84.
84?
That's why it was a big deal in 2017. We kind of got over that 80% hump. That was exciting.
Okay. All right. Thank you.
Thank you guys.
I'm going to jump in, and one of the things that we were trying to do with this presentation, sorry, I've lost my voice completely, is to show that we have like a vast bank of child policy experts, and we all have been saying we're like the Avengers before the Infinity Wars. Like we all have our special thing, like the Hulk or Black Widow or whatever, but we all work together to move policy forward. So we wanted you guys to be, that's why we have everybody in the audience answering all these questions. So
Yes.
we're ready for you. And now
Yes.
with that, I'm going to introduce our next Avenger, Dr. Vita Johnson. And from here, we'll just let people come up one at a time without
Okay.
you guys having to watch me do that.
Okay. Welcome, Dr. Johnson. If you would like, I'll just recognize them once the other person gets finished. So
Okay.
we'll move forward with that. So, Dr. Johnson, thank you.
Good morning.
Good morning.
I have to apologize. I'm just getting over the flu. Okay, everybody wear a mask. I didn't wear my mask today. So I'm a bit hoarse, and they also told me I only have 5 minutes. So I have to read, because if I have 5 minutes, it's my introduction. So thank you, Madam Chair, for allowing us to be here in General Assembly. So I'm Dr. Vita Johnson. I'm a general pediatrician and professor of pediatrics at Emory University. I'm also the director of Partners for Equity in Child and Adolescent Health at the Department of Pediatrics. The purpose of Partners is to increase access to health care and to improve the delivery of health care for underserved children throughout the state of Georgia. One of our premier initiatives is the expansion of school-based health centers. Our guiding principle is that it's easier to build strong children than to repair broken men. And even though our state has made some significant improvements over the years, we have a long way to go when it comes to building strong children. But it begins with the concept of the whole child. I'd like to start out with 4 key points that really set the stage for why thinking about the whole child matters, and why the data and the recommendations that we'll review today and that are in the primer are so important. The first is social determinants of health. There are 3 main determinants of health. They include our genetic makeup, our individual choices, and the social and economic forces that impact our health. Most of these forces are completely outside the control of the individual. They include where we live, our housing, our family income, our educational opportunities, our access to health and other services, and transportation. Another key point is the early brain development and lifelong social, emotional, and mental well-being for children. They have a direct impact on our health as children and continues throughout adulthood. So the social determinants, the early brain development, social and emotional well-being, they impact our educational achievement, which is the #1 predictor of health. And it's important to recognize that they all disproportionately impact children of all races. Having health insurance is the necessary first step to obtaining good health. With that in mind, our children are starting off at a disadvantage with approximately 200,000 of them currently uninsured. It is estimated that at least 40% of these children are eligible for Medicaid or PEACH care, but remain unenrolled. And even if they were to obtain insurance today, Georgia lacks the pediatric providers to fully meet the healthcare needs of the state. We also know that hundreds of thousands of children do not get the basic food and nutrition they need every day to develop and grow into healthy adults. They do not have access to healthy, fresh foods within their neighborhoods, nor do they have access to the amount of food they need to thrive throughout the year. All of these deficits and disparities are lifelong. We now know that most of the causes of inequities in adult health outcomes are rooted in childhood. And that becomes even more critical when you take into account that the health of the adults taking care of our children. It has been proven that the health-seeking behavior of parents impacts the health-seeking behavior of their children. Parents without insurance and with limited access to health care do not seek out primary care and preventive services. They do not get routine screenings or comply with prescribed medical management of their health problems, and this impacts their ability to care for their children. Equally important, this behavior is passed on to the child, and the cycle continues. So there are 4 things we need to do to address these issues. There are many things we need to do, but I'd like to highlight 3 that, if done sooner rather than later, can have an immediate critical impact. The first is to address the technical challenges that contribute to so many children lacking health coverage. It includes leaving the gateway systems, the online system for parents to apply for Medicaid and PEACH care for their children, to leave it on 24 hours a day, 7 days a week. We learned from talking with communities around the state that the system currently turns off at 5 p.m. The second is to ensure that the adults caring for our children, both the parent and the child care providers, have health insurance coverage and access to care. And third, that the state prioritizes funding for comprehensive school health programs. These programs help meet the health needs of children where they are every day at school. In particular, school-based health centers have been proven to increase access to health care, especially in rural communities, improve student health outcomes, particularly those with asthma, improve school attendance and seat time, and decrease the Medicaid costs to the state through decreased emergency room use and hospitalizations. Our state currently has 44 comprehensive school-based health centers operated primarily by our federally qualified health centers, and that these centers serve not only students and their siblings, but teachers, other school staff, family members, and the entire community. Expanding these centers will go a long way towards meeting the unmet health needs of our state. Thank you very much. Any questions?
I don't see any questions, but our chair of health joined us, and she says that we are expanding the school-based health-based the school-based health centers. So,
We're trying to expand them, And the community health centers, we now have 211 locations, only about 40 states that there's not a location in it.
Excellent.
I mean,
Thank
that is what we have been trying to do as higher-ups and people with a lot more authority than we have decided what other kind of health plan they're going to have for Georgia in trying to make Georgia's own health plan to take care of our citizens.
Thank you.
Thank you. All right, and next up we have Dr. Fiener Sitkoff from Voices for Georgia's Children to talk about mental health. Welcome.
Good morning. Thank you again, Madam Chairs and Mr. Chairman, for holding such an important hearing today, and the members of the General Assembly for being here with us. I am Dr. Erica Fenner-Sitkoff, the Executive Director of Voices for Georgia's Children. So I have the pleasure of partnering with Polly and the rest of our team. But in addition to that, I'm a licensed clinical psychologist and was privileged to be a member of Governor Deal's Commission on Children's Mental Health. So I'm particularly honored to be here today to provide some highlights to the mental health section of our primer. Children's mental health, unfortunately, is increasingly becoming a life or death issue in our state. In 2016, it became the second leading cause of death for Georgia children aged 10 to 17. And each year, the Department of Education does an incredible thing that provides important insight to all of us. They implement the Student Health Survey. And last year, approximately 700,000 children in grades 6 through 12 completed that survey. Well, they report on their thoughts, feelings, and behaviors. Through that, we learned a little over 100,000 of Georgia youth contemplated harming themselves in the past year. Nearly 80,000 contemplated suicide, and a little over 30,000 actually reported making some kind of attempt. And in last year in Georgia, the youngest person to take their life was 9 years old. So I'm thankful that the General Assembly, the administration is taking considerable action to do something to meet this need. We're getting better at identifying children that are in this need through the investment that's been made and an increase in teachers trained in mental health first aid, through the increase in schools that are implementing positive behavior intervention supports, PBIS, and the increase in school-based mental health access for things like Project Apex with DBHDD. Unfortunately, though, even with that, we know roughly 60% of youth that need intervention don't actually get the intervention that they need. Many times that's because they haven't been identified, but even more so, it's that the particular provider intervention is hours away from their community, or there's months-long wait lists. That we see that with child and adolescent psychiatry, and the leading interventions for autism with BCBAs. And sometimes it's because of administrative barriers and processes. For example, providers not being able to get the authorization to provide services to young children that need intervention and support. Or there's a lot of confusion in communities when we were talking across the state about what is or is not actually allowable in telemedicine. In response to these issues, we're highlighting 3 key recommendations that if we did something about right now could make a considerable difference. First is to continue and invest in and support in the recommendations made by Governor Deal's Commission on Children's Mental Health. We saw that in the proposed budget with the increase, the $8.4 million to expand Project Apex. It would be incredible if we could see school-based mental health access spanning across the state. Second, improve our ability to address workforce shortages by collecting and monitoring behavioral health workforce data in a similar way that we currently do with physicians, with the Georgia Board of Physician Workforce. We could develop more effective workforce strategies if we simply knew where our workforce was and the age that they serve. We operate data blind right now. And the data that we currently collect, the systematic data we currently collect from physicians, is a great example of what we could do with behavioral health workforce. And third, support the development of protocols and standards for improved and expanded provision of behavioral health telemedicine. There isn't one standard or approach or information out there of what's possible, and that could go a long way for effective use, particularly with mental health. Thank you very much.
Thank you. Does anybody have any questions for Dr. Fiener-Sitkoff? Hit your button, Sharon, so I know which one you are. Oh, there we
Okay,
go.
sorry.
Yep,
I'm
there
not
you
used to having it.
No, I'm sorry,
My
Chair,
bad.
Chairman Cooper?
That's okay. I I will tell you that we had yesterday in the health meeting a report from the community health centers. They are telling me now that their goal is to have one qualified mental health worker or counselor in every high school, at which point I said we need to start earlier in
Thank you.
being able, they need to
Thank you
be
very
in our
much.
primary schools. Of course, there is a lack of providers that are qualified, and I think that qualified is extremely important when we're working with mental health.
Completely agree.
And, you have to start somewhere with funding, but they will be asking for more funding and are trying to get, to begin with, one qualified clinical worker in every school. Or in every high school to start with. I agree with you about needing to know where our workforce is. I think that's, maybe we can talk to the physician's workplace and see if they want another project. And what I want to know is that survey's very good that the school system does. At one point, it was not shared with many people where it could be utilized. Is that still the problem with the access of the results of that?
No, it's public now. It's publicly available on the website
But is it
by
something?
school,
is
by the
it-
DOE website by school.
Okay, but is there some way that it's not put out in a certain way where it really is meaningful, or it needs to be? I mean, that's somebody came and talked to me at the end, during the summer about it, and I'm trying to pull that up among other things.
Representative Cooper, I'm Gary McDevitt of the Department of Education. The results of the student health survey are available to the public, but not at the individual level. It's at the school level, district level, and even state level. And we are working with, we had a group of users, the administrators and teachers and parents, tell us what do you need if you look at that data. So they gave us a list of things that would help them. So it's not just a PDF they have to copy and paste and then do the calculations themselves.
Right, that's what the problem was, okay.
So we have contracted with IT internally to try to make it user-friendly so they don't have to cut and paste and do their own calculations. So pretty soon we should have it much easier for anybody to do calculations at the school level, district level, and state level.
And I thank the department for that, because really, I mean, you can drown in data, but if it's not usable data, then people just throw up their hands in frustration. And I think that's what people came to talk to me about. When you say soon.
Oh, probably before the end of the school year.
Okay, thank you very much for that. Thank you, Madam.
Thank you.
Secretary.
Thank you,
you.
Doctor. I appreciate that. And now we'll hear from Director Jillian Neighbors, who's the Director of Prevent Child Abuse Georgia. Just make sure that you talk into the mic, because we do have people watching online, so
Sure,
they
absolutely.
can't hear unless you're near the
talk
mic. So
directly into
thank
the
you. Welcome.
Well, thank you, Madam Chair, for holding this important hearing, and members of the General Assembly for being with us today. Again, my name is Julia Neighbors, and I'm the Director of Prevent Child Abuse Georgia, which is the state chapter of Prevent Child Abuse America. Since late 2011, we've been housed in the School of Public Health at Georgia State University, and our work centers around building and supporting a statewide network dedicated to preventing child abuse in all forms. We support 22 local child abuse prevention councils around the state that covers 43 counties. And we also operate the 1-800-Children Helpline, a free statewide information and referral number for parents and caregivers and professionals who work with families, providing community-based resources to callers. And we also provide mandated reporter training around the state. As an appointed board member of the Department of Juvenile Justice, a member of the Children's Justice Act Task Force Captive Panel, and a longstanding partner of Voices, I'm thankful for the opportunity to present to you some of the key points of the protection and safety section of the Whole Child Primer. I'll start by saying that we are all here because we want to make sure that all children have safe, stable, nurturing relationships and environments, and that there are reliable, effective, and proactive systems in place to protect children from trauma, injury, abuse, and exploitation. Currently, there are close to 13,500 Georgia children in foster care, which is less than the 15,000 when we completed the primer this fall. And while this trend is positive, we continue to have more children in foster care today than we had several years ago. We have a unique opportunity to do something to reverse that trend with the newly passed federal Family First Prevention Services Act. To understand how to best use that legislation and build on the positive impact the investments the Georgia legislature has made in recent years to support DFACS to keep families strong and together, let's turn to the leading reasons why children are entering foster care. Of the nearly 27,000 children who were victims of substantiated child abuse or neglect in 2015, 75% were neglected, 11% were physically abused, and 4% were sexually abused. Parental substance abuse has played and continues to play an increasingly major role in many of these cases. And now, for the first time, the Family First Prevention Services Act enables Georgia to use federal funding through Title IV-E funds for prevention services. We will now have more funding to support things like substance abuse prevention and treatment for parents, as well as mental health services. Homelessness and housing challenges play a major role as well, and each year more than 45,000 children in Georgia experience homelessness. And while housing challenges may be a contributing factor in neglect cases, it does not have to be. There are actions that we can take to help families secure safe and stable housing. I'd like to close by highlighting 3 recommendations from the primer that support these points. Support investments needed in DFACS and other public and private providers to maximize implementation of the Federal Family First Prevention Services Act. This includes the investments in the governor's fiscal year 20 budget for DFACS, as well as looking at how Medicaid can also support providers in implementing prevention services. Number 2, increase the availability and equitable distribution of quality and affordable housing and support policies, including rent subsidies, which protects families and children from unsafe housing, hardship or baseless evictions, and untenable fees and penalties. And finally, fund and implement child development training and child trauma training for adults who engage or work with children in any way. This includes teachers, school resource officers, public safety officers, and healthcare providers. Having this fundamental training and increasing awareness can go a long way in de-escalating challenging situations. These types of trainings would provide necessary context about where a child is developmentally and emotionally for those professionals who must make critical decisions that impact a child's life trajectory. Thank you. Are there any questions?
Thank you so much for that presentation. Members of the committee, do you have any questions? Okay, thank you very much. I appreciate that. Now we're going to hear from Judge Bradley Boyd, presiding judge from the Juvenile Court of Fulton County. Judge Boyd?
Thank you. Let me just time myself here. Give me 30 seconds for my own soapbox. The fact that there are 3 committees meeting here together, to me, is a wonderful sign. And in the past several years, Georgia has taken some very significant and important steps in the area of juvenile justice and all the areas that impact juvenile justice and school safety. And I mentioned before this session started, Georgia really has the opportunity to become a leader, the leader in the nation on some of these issues, because we've already got a good start. We've got a new juvenile code. We have a reformed juvenile justice system. We've got opportunities to work in the Child Abuse Prevention Act that's starting this fall. So Georgia has a choice. You can take the big steps and really step out as the leader, or you can wait for someone else to plow the field and walk through the clods. You've climbed that big tower. You've hooked up the bungee belt. You've walked to the edge. I'm urging you to jump. Everything you've heard up until now and everything you will hear afterwards has a lot to do with juvenile justice and school issues. It costs $90,000 to detain a child in a juvenile detention center for a year. What we know is that locking children up, whether as a prevention or as a sanction, really increases the likelihood that we will see them again and see them deeper into the juvenile justice system. So we have taken steps, and the Judge Assembly has taken steps. Our system has taken steps to reduce the use of detention for children, and that sometimes is a hard sell to the public. We've reduced by 47% the delinquency-related out-of-home placements by 47% from 2012 until 2016. 1,390 youth were diverted from out-of-home placement through the Georgia Juvenile Justice Incentive Grant Program, which is targeted to repeat and more serious offenders. These are the kinds of kids that sometimes scare people. But we've got some of those programs in our court. We have them in other courts in the state, and we've seen a 70% successful completion of those programs. These are children that probably in the past would probably have been sent to juvenile detention centers. More than 7,700 students have participated in state-funded, evidence-based behavioral change programs to prevent recidivism since 2014. Now, there are, in the 2016-17 school year, 205,900 students in Georgia K-12 were disciplined with out-of-school suspensions, put out of school. Now, what we know is that taking a child out of school, first of all, increases the likelihood of delinquency. And secondly, one study has shown that at the 8th grade level, if a child misses school for 15 days, their prospects of graduation drops from in the 80% to in the 30%. About a 50% drop in their likelihood of graduation for 15 days of being out of school. And whether that's excused, whether that's illness, whether that's truancy, whatever it is, it's keeping children out of school. And I recently wrote a column that said, for all the effort and discussion that's been going on and grant money that's been provided to improve schools, looking at some of the millions of dollars that have come from some very major donors and philanthropists in the United States. One of the things we're simply overlooking is the elephant in the room, and that is what's happening in the home. So everything you've heard up until now relates to what goes on in the home before a child goes to school, before a child shows up in court. What keeps children out of school? Domestic violence, homelessness, unstable housing, physical health. I think asthma and dental issues are the two biggest factors that keep kids out of school. Substance abuse, neglect, physical and sexual abuse. These are keeping kids out of school. By keeping kids out of school, we are increasing the risk that they become offenders. So let me jump very quickly to some recommendations that have come out of this that the Voices is pursuing. Continue evidence-based interventions for youth that are at high or medium risk to cut down on, and that's what's available through the incentive grant program that we are using and has shown to be very effective. Improve technical assistance to develop reliable funding mechanism for all juvenile courts, children in need of services programs. These are unruly children, truant children, children that are very often display behavioral and mental health issues that need treatment. We need to be able to find supports and services for those. And frankly, one of the things that's hampering us right now is the availability of insurance and Medicaid to cover the therapy that needs to go into addressing those problems early before they become full-blown delinquency cases. Increase juvenile courts, the jurisdiction of juvenile courts for children up to 18. That's an issue that I think will probably come up in the legislature this year. I think it's an aspirational goal. It's very resource heavy. I think we ought to be thinking about moving that direction. I also believe, though, that however there's some very low-hanging fruit that can be addressed with much more manageable resources that can be very effective, and we're already seeing some results from. Thank you.
Thank you, Judge. I appreciate your presentation. Number 26, you have a question for Judge?
Yes. Thank you, Rep. Ballinger. And so you were just saying that I'm sorry, you were. I'm trying to remember now. I'm so sorry.
It's all good. If
Yeah.
you would like to circle
Yeah.
back with
Yeah.
me,
So thank you.
I can get in touch with Judge Boyd anytime.
thank
So I'll be more than happy to follow up with him or
Okay.
facilitate that contact
you
if
so
you think
much.
of it at a later time.
Thank you.
That's perfectly fine. But I appreciate your presentation.
Anyone
Thank
is
you so
welcome
much.
to call me at any time. I mean, 5 minutes to talk about what is happening in juvenile court includes all this stuff. It's a short trip.
As somebody who chairs that committee, I know it's very brief and impossible to cover in 5 minutes, but you did an admirable overview. I appreciate that. that. Now we're going to hear from Mindy Benderman, who's the Executive Director of the Georgia Early Education Alliance for Ready Students.
Good morning, and thank
morning.
you so much for having us, and thank you to our partners at Voices for Georgia's Children for putting the Avengers together. I appreciate that. As the chair said, I'm Mindy Benderman. I am the Executive Director of GEARS, the Georgia Early Education Alliance for Ready Students. We work every day to support high-quality early learning and healthy development for Georgia's youngest children, birth to 5, by championing policies, promoting innovative and evidence-based practices, and building public will. As you've heard, these early years, particularly the years prenatally to 5, are a critical foundation, not only for reading, academic success, and high school graduation, but also for long-term positive outcomes such as health, employment, and reduction of risky juvenile behaviors. Today's children are tomorrow's community leaders and workers, and the future of Georgia depends on these children reaching their full potential. I'm going to highlight 3 recommendations in the primer. There are more, and we're happy to give you more information, but in the interest of time, I'm going to highlight 3. First, and most importantly, as you know, in the first 3 years of life, brain connections are developed in the most rapid pace. As a matter of fact, about 1 million new neural connections are formed every second of a child's life from birth to 3. That creates that foundation for learning that we talk about later, and those connections can be weaker or stronger depending on the supports and the loving interactions that children and infants and toddlers have with loving caregivers, whether those are parents or grandparents, neighbors, or teachers. And so one of the things we want to do in those first few years of life is ensure the highest quality care for them, both at home and out of care when their parents have to work. Affordable quality childcare not only fuels Georgia's economic engine by helping parents work, but it also builds the workforce of the future. We recently did a study with the Metro Atlanta Chamber of Commerce about the loss to Georgia's economy when parents can't access high-quality childcare. And we quantified that about $1.75 billion annually is lost when parents can't go to work, either through absenteeism, through having to leave a job or turn down a job, $1.7 billion annually. So what can you do about that? You can help make childcare more affordable for Georgia's working families. We have a program called the Child and Parent Services Program, or CAPS. It is available to families who make under 50% of the state median income. We actually have one of the lowest eligibility guidelines in the country, and even so, we only serve about 11% of eligible families. This is important because childcare can cost up to 40% of a low-income family's income. Health and Human Services says it should cost around 7%. So we have to make childcare more affordable and more available, high-quality programs available for those families, and you can help by funding the Child and Parent Services Program, or CAPS, through the Department of Early Care and Education. You can also help families and parents in their homes. Sorry. I messed this up. Sorry.
Sorry, guys.
You can also help parents in their homes. One of the things that we have is high-quality home visiting programs that reach families where they live voluntarily by matching parents of young children and expectant parents with trained professionals who can help nurture positive child relationships. We have too few of these programs in Georgia. These programs are proven to support better birth outcomes, reduce child abuse, and prepare parents to be their child's first teacher. And so we want to support those voluntary, high-quality home visiting programs as well. And finally, we want to ensure that children receive the early screening and detection of developmental delays and chronic conditions that they need to build that strong foundation, birth to 5. Our Babies Can't Wait program in Georgia serves about 2016, served about 17,000 infants and toddlers in Georgia. But according to the CDC, there are about 100,000 of Georgia's children birth to 5 who have developmental disabilities. So we need to ensure that Babies Can't Wait doesn't keep babies and families waiting, that it really does help those early detection and intervention programs that we need so that kids and their families can become healthy, productive citizens of Georgia and have that strong start and strong future. So I thank you. You can hear more about these issues. We have an event on Friday, and you're all invited to lunch at Central Presbyterian. We call it Strolling Thunder. You will have many of your constituents will be there with their infants and toddlers. We'll have photo booths. We'll have more cookies, for those of you who like the Gears cookies, and lots more information, and we welcome you all there as well. So again, thank you, and we'll be pleased to work with you.
Thank you. I appreciate that. Do you have a question? Okay.
Well, early childhood development is near and dear to my heart since that was my basic undergraduate degree. And I want to thank you for the work there, because if you heard all these other issues, you know, what we do in those early years sets the foundations for families. It's especially true on drug abuse and the families dealing with children. For the committee, I'd like a little help with public health. Public health nurses, we have a public health department in every county in this state, but nurses have gotten away from doing the things they used to do in public health, like teach mother-baby courses and evaluate babies. Now, the state doesn't run all those county programs. They're run by county boards of health. But somehow or other, we need to get back. We are already there. They're in the communities, and utilize those and get those nurses to work with people more. So anything you can do to help me with that as we go forward, that's a resource that's greatly being underutilized.
Thanks, Representative Cooper. Also, there's a centering, public health runs centering pregnancy programs throughout the state that are also really successful, and we'd love to work with you on some of those issues.
Thank you.
Thank you. And now we're going to hear from Ariane Weldon, who's the director of Get Georgia Reading Campaign. Ariane?
Thank you. Thank you for the opportunity to speak to you today. My name is Ariane Weldon. I'm with Georgia Family Connection Partnership, the lead organization for the Get Georgia Reading Campaign. We can all agree a strong workforce is essential to a strong economy. Right now, the biggest threat to our workforce is the fact that nearly 2/3 of our kids, both Georgia and nationally, cannot read proficiently by the end of 3rd grade. This is because it's at the end of 3rd grade when children must shift from learning to read to reading to learn. Imagine being in the 4th grade where the curriculum depends on your ability to read to learn any subject, including math and science. And without knowing how to read, you fall further and further behind. And this is why children who can't read proficiently by the end of 3rd grade are 4 times more likely to drop out of high school. And every student that doesn't complete high school costs our society an estimated $260,000 in lost earnings, taxes, and productivity. Here's the thing. Literacy isn't just an education issue. It's an urgent priority for all who care about children's health, well-being, and the future of our state. This is why Georgia's education policy leaders have joined together with health, child welfare, economic development, nonprofit partners, and others. Together, we're taking a new approach. We identified over a dozen factors that affect a child's ability to learn to read, impacting their path to high school graduation. Here are just a few. First, the path starts earlier than many people might realize. The mother's level of education is a significant predictor of the child's literacy outcomes, indicating the need for approaches that support the entire family. Second, the number of loving words a baby hears in the first 3 years of life makes a big difference in a child's language development. And why does that matter? Because research shows that more than poverty and parental education, the most important factor in achieving literacy by 3rd grade is a child's language skill at kindergarten. A third factor affecting kids' ability to read is accessing preventive health care. For example, common vision impairments affect up to 25% of students, and left uncorrected often lead to disruptive behavior and poor academic performance. And fourth, a positive learning climate where children feel safe, welcomed, and engaged has a dramatic impact on student outcomes. Recent data show in Georgia, every school receives a school climate rating on a scale of 1 to 5. Recent data show that a 34 percentage point difference in literacy outcomes with a rating of 1 versus a rating of 5, a 34 percentage point difference. And that difference continues throughout middle and high school. So now we come to the great equalizer. We analyzed the 3rd grade reading scores and high school graduation rates of more than 98,000 students in Georgia. We found that students who read proficiently by the end of third grade had a significantly higher graduation rate by a nearly 30 percentage point difference. They were far more likely to take the ACT or SAT by a nearly 50 percentage point difference and achieved higher ACT and SAT scores. The results are consistent regardless of race, English learner status, or poverty. So what does this tell us? If kids learn to read proficiently by the end of third grade, they're in the game. Whether they choose a four-year or technical college, the military, or other workforce training opportunity. With a shared understanding of the factors that affect a child's ability to read, to learn to read, the partners created a shared framework for action. This framework has 4 pillars that are referred to in the glossary of the primer. The 4 pillars define the conditions that must be in place so that all children are on a path to third grade reading proficiency and high school graduation. Members of the legislature have already been important investors and partners in this work. For example, you've invested in PBIS and established policies that support learning climates. You've invested in healthcare access, including children's mental health. You've supported quality early learning access through investments in Quality Rated. But there's more to be done. My ask is that you remember getting more children to read, putting them on a path to being successful adults, takes more than good schools, more than great teachers, and more than loving parents. We need your help achieving the expectations defined by the 4 pillars so that all children are on a path to learn to read by third grade and can read to learn throughout life. Thank you.
Thank you very much. And number 25, you have a question?
Just very quickly, thank you, Madam Chair. I was just curious because there's been a lot of discussion, particularly with the Rural Development Council, about the necessity for broadband to students all over the state. And I was just curious if you had done any studies or there was any, evidence-based that we needed that internet for kids to help to learn to read.
Those were some significant recommendations in the report, and yes, that's one of the factors that affects healthcare access and also being able to learn at home in the summer months and then after school. So thank you for your work on that.
Thank you. And now to wrap up, Polly McKinney.
One more.
Oh, okay. Oh, I'm sorry, Katie Landis. I do apologize.
It's fine.
She is the director of the Georgia Statewide After School Network. Katie, thank you. Sorry.
No problem. I want to echo everyone's thanks to Madam Chairs and Chairman for having us all here to speak with you today. Again, I'm Katie Landis, director of the Georgia Statewide After School Network. Up to 80% of a child's waking hours are spent outside of formal classroom learning. Excuse me. That's a lot of time that we can either be doing something really great or not. YMCA's, Boys and Girls Clubs, 4-H, and school-based after-school and summer learning programs are critical to addressing many of the issues you've heard about this morning, such as physical and mental health, juvenile justice, and education. Research shows that high-quality after-school and summer learning programs increase graduation rates, decrease juvenile crime, reduce drug and alcohol dependence, and promote healthy lifestyles. What's more is that these programs also support Georgia's working families by providing more than just a safe place after the school day and year ends, so that working parents can stay in their jobs and in the economy. A lot of great work is already happening around the state. Over 100,000 young people in Georgia have access to after-school and summer learning programs that allow them to build skills and explore new interests thanks to 2 federal funding streams. And these programs specifically have allowed teens to land summer internships through partnerships with major corporations, struggling readers to build their literacy skills in fun environments, students to cultivate STEM interests through project-based learning, and young people of all ages to build the social and emotional skills that are so necessary to be successful in the workplace through mentorship. But there's still a lot of kids who need access to these high-quality, enriching programs. Currently, there's no dedicated funding, state funding in Georgia for these important programs. And 67 of Georgia's counties do not have an after-school or summer learning program supported by the federal funding that I mentioned. In order for all of Georgia's kids to make sure that they're reaching their full potential, I really encourage you to consider what supports and services are available after the school day ends, over school breaks, and during the summer for Georgia's learners. I want to highlight for you today 3 of the recommendations that you'll find in the primer. One is to expand state funding to after-school and summer learning programs to increase access to and affordability of care. Very similar to what you heard about early learning. it is critical for families and for students that they have access to these programs so that they have a space to continue to learn and to continue to explore new interests while also being safe, and families have a place to, and parents continue in their jobs. To increase state funding for the CAPS program that you heard about earlier from Mindy, that program, in addition to serving Georgia's youngest learners, 43% of CAPS recipients are school-age children, so those in the after-school space and during summers. And also to encourage technical education, work-based learning, and apprenticeships to older youth to prepare them for the jobs of tomorrow. These recommendations, along with all of those others that you'll find in the primer, can work together. All of these issues can really work together to make sure that Georgia's young people are on the path to success in college, career, and life. So thank you for today.
Thank you so much. I appreciate that. Polly, if you'll just give us your quick recommendations for the census, and then
Yes.
some of us have to be in rules
Yes.
now. So
I'll be expedient. And basically, I can lay it out like this. Last year in the 2020 census is coming, for any of you that didn't know that. And the challenge that we have here is 80% of the census the feds would like to have done online. So to your point about broadband connectivity and access, it's very challenging. We will still have people to go around and knock on doors and stuff, but it's a thing. And last year, children under 5 were the most undercounted of the census. So there were 1 million across the country who are not counted that we know of. Don't ask me how we know it was 1 million. It's a whole long story. But at that time, there were not. And to the point of this is that we have, in the 2010 census, the census is the denominator. Those numbers are the denominator for all of the funding formulas and for work that business and industry do and all those sorts of things. So it's a very important thing to us to make sure everyone is counted, and especially children. And so with that in mind, I just wanted to flag it for everyone because it's coming soon. It'll come faster than we know, but we have to find ways and possibly funding, because we're not getting much, I don't think, from the federal government at this point, to make sure that everyone is counted. In 2010, we picked up a congressional seat because of the 2010 census, even with undercounting, and our population has grown. And so we're all about trying to find a way to count the hard-to-count folks, and that's what and I just want to say thank you all so much. The Avengers appreciate, speaking on behalf of all our Avengers, we appreciate the opportunity to share our information with you.
yes, and we appreciate the Avengers. As chair of Juvenile Justice and dealing with a lot of child welfare issues, know that my office is always open. I'm always available if anybody would like to meet with me. 218 over in the Capitol. I finally got out of the basement. So, and I know that other chairmen here, Chairman Cooper, Chairman Jespers, that had to leave, I'm sure, for appropriations, but we all, are dedicated to this issue and all want to move the state forward. So thank you so much, and we are adjourned.